Good afternoon, everybody. Sorry for a couple minute delay there as we worked out some microphone issues, but welcome to our Friday afternoon news conference for the city of Grand Forks. I do have one change in the schedule. I realized we initially said we would have a representative from the Grand Forks Park District. Literally, I got a phone call 5 minutes ago due to plans outside of their control. Ms. Jill Nelson is unable to join us today, so we'll hopefully hear from Jill next week. But there's no Grand Forks Park District on the call today. Media members, we will hear from our panelists, and then we will have a Q&A with you guys afterwards. And as we have started with these every time, we'll let things kick off with Mayor Brown.
Well, thank you, John. Today, Grand Forks Virtual News Conference, Friday, May 1st, 2020. We're going to have with us Dr. Joshua Deere of Altru Health System and Meredith Richards with our Community Business Development Program. And Lisa Swanson from Hugo's will be with us today. So now with my opening statement, I want to thank you for joining us and staying informed. Governor Bergen's executive orders on business closures expire today, and businesses that were previously closed can open their doors if they feel they can do so safely. This will not be returned to business as usual, and there are a number of standards and guidelines that need to be met. The state standards and guidelines are minimum requirements, and you can enact more stringent measures if you feel necessary. I encourage you to do what opening your business is voluntary, not mandatory. Consumer confidence is essential, and I encourage the citizens of Grand Forks to support local businesses in a way that they feel is safe, whether that be through takeout, curbside pickup, delivery, or on-site dining. Part of the Grand Forks businesses, standards and guidelines. Grand Forks. We appreciate everything our local businesses are doing as part of our GF Smart Restart. We've already seen the serious approach our local businesses are taking in the best interest of their employees and customers, and thank them for being responsible when it comes to helping slow the spread. The high responsibility that's been placed on individuals and businesses throughout this situation has just gotten higher, and we have already seen our local businesses answer the call. For that, thank you. We have Meredith Richards on today, who is leading our community business development team. She and her team have been working hard on this Grand Forks Smart Restart, and we'll talk about some of their efforts in the past few weeks, some resources available, and what to expect as we enter the new, different normal. We also have Lisa Swanson from Hugo's on the panel to talk about what it's like owning a business with high traffic during this pandemic and the preventive measures they will have put in place. For those businesses opening up or considering opening, they provide a good example of local businesses effectively enacting CDC guidelines and recommendations. For the weather, please remember this. Utilize the beautiful greenway and our bike path system. Remember, the number of confirmed COVID-19 cases in Grand Forks County continues to rise, in part due to the robust testing conducted in the effort to identify and contain the virus in our community. Now is not the time to let our guard down. Remain vigilant and be cautious and support local businesses. And now we'll go to Dr. Joshua Deere with Altru Health System. Welcome, Doctor.
Thank you, Mayor. Good afternoon. I'm Dr. Josh Deere, Medical Director of Primary Care at Altru. Thanks again for the opportunity to join all of you today. As the businesses in our community determine how to safely open, many in the community are likely determining how and where they'll go. We at Altru want to encourage you to visit us. Over the past 7 weeks, not only have we tested 2,700 people for COVID-19, we've also put in place many strategies for creating safe care environments for our patients and staff. These measures include masks required for all staff, patients, and visitors, strict visitor restrictions, screening of all patients prior to their care, quarantine protocols prior to procedures, and more. With these measures in place, we can safely care for all patients in our clinics. I want to emphasize that continued care is extremely important. We've heard reports across the country of a rise in advanced disease states or more urgent care needed as patients avoided preventive care or waited to access the ER upon first sign of symptoms. We do not want this for our patients or our community. This is why we focus on safe practices so that all patients, whether they have concerns of COVID or not, can receive safe, high-quality care. Please call your provider's office to learn more about your options. As I close today, I want to ask the community to continue safe practices as we adjust to a new normal. Please continue to wear cloth masks in public, including when you visit us at Altru. Please keep social distance measures in place. Please follow the guidelines of the businesses you plan to visit. We all have the responsibility in continuing to slow the spread while we adjust to a new normal. Thank you.
Thank you, Dr. Deere. And now Meredith Richards, our Community Business Development, will give us a report. Thank you, Meredith.
Thank you, Mayor. As we all know, Mayor Brown has made it a priority to make sure that Grand Forks and City Hall is business friendly and that we have a very business friendly environment. So as we start the North Dakota Smart Restart, we're going to use our business development group to roll out the GF Smart Restart. So we have got a web page that is, we hope, highly visible, that will provide a resource for businesses to access information on Smart Restart, but also introduce businesses to our business development team, which is kind of a new construct of our combined planning and community development departments. So with this group, we hope that we'll help take some of the pressure off the health department in terms of the phone calls and questions that they're fielding. And, you know, obviously they've been doing yeoman's work on this COVID crisis for several weeks. But as we move into this very kind of business specific portion, we want to not only help them with taking some of that workload off, but also introduce businesses to our business development group and some of the services beyond just helping navigate these this information flood that we're getting in these very changing times. We want to help with that, but we also want to make sure that businesses are aware of the other services we offer, whether it's, you know, business assistance programs, incentives, just information if they're trying to navigate maybe while their business is shut down, a renovation project. So basically the message is check the website. We've got access through 311, email, phone calls. We don't have all the answers, but if we don't know the answer, we're pretty good at finding questions, and we want to provide a good conduit for information for businesses, not just for the Smart Restart, but any of their questions as we move through this crisis and hopefully into stronger days for our economy.
Thank you, Meredith. And now we'll hear from Lisa Swanson from Hugo's. Welcome.
Thank you. Thank you, Mayor Brown. We also want to thank you and your whole team for these daily briefings that you're doing, just to keep us all informed and up to date. So we do appreciate that. We started with Hugo's. We did not close down, obviously. So we started in early March by taking procedures like the deep cleaning, sanitizing hygiene procedures with our associates. And we ended up shutting down all of our sit-down delis, our salad bars, hot bars, soup bars, things like that. And those do remain closed down today. And as this has gone on, we have made other changes in recommendations from both state and local and national recommendations on what businesses need to be doing and what's going to be best to keep our associates safe and our customers that are in our stores. So while we have implemented a very rigorous and strict sanitizing policy, we keep that in place. We also have companies coming in at night in all of our stores to do a separate kind of deep clean sanitizing. So we've kept that up, and we also changed the hours of the stores to close at 10 p.m., which gives our associates a little bit of a break. And it gives us a little more time for the extra cleaning procedures and sanitizing procedures that we've added on during this time. And we did change our hours on Sundays from 8 a.m. to 8 p.m. just for the same reasons and to help out both our associates and to keep the safety measures going that we implemented and have to keep up. But some of the new things that you've probably seen, we have plexiglass installed on all of the check stands for the cashiers to keep kind of a barrier between both the team members and our customers. All of our associates are wearing masks, and they are required to. We have signage in the stores encouraging and asking our shoppers to also wear masks. I think that's the best way to keep all of us safe, both the shoppers, the customers, and our team members. And we do have other signage kind of outlining the social distance, where 2 cart lengths equals your 6-foot distance. And we have some floor decals as well at check lanes, so people have an idea visually where to stand to keep their distance between someone else. And we've also put down directional one-way arrows to keep the traffic in our aisles going one way. This will help in a way to keep people from crowding, to keep people from passing. And I know it's different, and people are getting used to it. Every day we see it being followed a little bit more, and we understand that, and we appreciate the effort that our shoppers are making to look when they're going down an aisle and follow the directional arrows when they're going up and down the aisles. So with our associates, we've been encouraging very strict sanitizing procedures, the mask wearing. We have signs in all of our associate break rooms that outline the proper way to wear a mask, the proper way to put it on and to take it off. And we also have signage for them on the proper way to use and put on and take off disposable gloves. So we can ensure that when they're using these things and doing this, that they're doing it the correct way and the proper way. Something that we did as well is took out chairs and tables in our break rooms to limit how many people could be in there at one time and how close they could be sitting together so that we can maintain the 6-foot distance. And we also had large banners printed that tell and encourage our associates to keep a 6-foot distance. And it actually has an arrow that is 6 feet apart. So 6-foot distance is very apparent, and people know exactly what that is when they're in there. So that's been extremely helpful. We did increase our online shopping opportunities in the Grand Forks area. All of our stores have online shopping with delivery and curbside pickup, and we have seen the traffic and the business in that area increase several times over. So we are keeping them very busy. We have added extra people on to try handle the traffic. We did contact our company that does our online shopping platform, and in very short time, thanks to them and to our team members, we added both the North End store in Grand Forks and the East Grand Forks store on as online shopping with curbside pickup, just to help kind of alleviate some of the stress on the store on Columbia Road in Grand Forks that is doing the online shopping with delivery and curbside pickup. So we are trying our best. Our associates have been working around the clock. They're doing fantastic. We are so fortunate to have the group of people working with us that are doing everything they can to serve our community. So they will continue to do that. We will continue to keep up these measures as we go forward. We are watching all of the recommendations and the guidelines, and we will follow them, and we will keep doing those as long as we need to keep everybody in our community safe and still provide a valuable service to our communities.
Well, thank you for keeping us safe while providing a very valuable service. Thank you very much. Now we'll go to John Bernstrom for question and answer portion of our daily news conference. John?
Thank you, Mayor, and members of the media. Yes, use the hand raise feature, and hopefully, Mayor, your mic will hold out there. It kind of popped in and out during your comments at the beginning, so we'll be conscious of that. First question from Mr. Joe Bowen. Go ahead, Joe. Oh, I'm sorry, Joe. Go ahead.
Oh. All right. Hi. So does Altru or whoever have enough tests to test everyone in Grand Forks for whom it's medically necessary? In other words, for people for whom the outcome of the test would change the course of their treatment?
Yes, we have enough tests to test anyone by state guidelines at this time. We have 633 available today for community testing.
Thank you, Dr. Deere. Next question from KNOX.
Thank you. It's a question for Dr. Deere. Dr. Deere, I was told earlier today that Altru has 8 patients in the hospital with COVID-19 at this point. The hospital, according to your online records, lists a bed capacity of 240. Obviously, there are other people in the hospital with different things besides COVID-19, so I understand that. But at what point do we say that we really can't overwhelm our healthcare system? And what role does the medical community have in expressing that opinion to those that make decisions about what can and can't open?
Yeah, that's a really good question. As your number of 8 is right, and we have 8 total cases at Altru. Rough data suggests that that's well under the projected 5% with severe illness. Also, we've given convalescent plasma therapy through our cooperation and collaboration with Mayo and our internal lab as part of their clinical trial to 4 total patients. Getting back to your capacity question, right now, we definitely have capacity in our health system to handle any surge. I think time will tell over the next week or 2 as to how cases increase or decrease. Majority of people presenting are at day 5 to 10 with their illness increasing. So the further we get out from these mass testing events and large spike in cases, the better we look from a health system perspective.
All right, next question from Mr. Neil Carlson. Go ahead, Neil.
Hi, I guess both for Dr. Deere and Mayor Brown. As the bars and restaurants open up now, is there anything special you're going to be monitoring? I mean, like block per block or just overall cases across the city, or what happens when all these different businesses open up?
Mayor Brown?
Well, we're going to start with education and then voluntary compliance. And these guidelines will help us monitor what's going to happen. And then we'll be in contact with the healthcare system to see when they feel it is time to enact something different locally. So yes, we'll be constantly monitoring the situation.
Yeah, I agree with that. I think that it's more a Department of Health question for contact tracings, if there are any positives that can be linked back to anywhere in particular.
Next question from Mr. Chris Larson from the Flag.
Question is for Mayor Brown. Fargo Cass Public Health yesterday said that they're going to be having extra inspectors out doing spot checks at restaurants and bars as they open up. Do you know, is there any plan for that in the city of Grand Forks?
Not that I'm aware, but our public health system will be monitoring that situation.
Next question from Mr. Matt Henson at WDAY.
This question is probably for Mayor Brown. What do you think about the fair coming up in about a month and a half? Do you think that's going to happen?
I don't have a crystal ball, but I don't think we'll wait and have to see how this pandemic is going. But right now, it's still highly contagious and potentially fatal. I don't see that public events like that happening at that time.
Ryan Cunningham from KNOX.
Question for Mayor Brown. Last on Wednesday, when I spoke with Debbie Swanson about the contact tracing investigations, she mentioned there were additional tools that you had to ensure that people cooperated with contact tracing. I don't know. It doesn't seem like she's available today. In checking with the state, they tell me that they're unable to compel anybody to cooperate with your contact investigation. Can you elaborate on the tools that she was referring to force people to comply with that?
No, I would have to defer that to her.
Mr. Joe Bowen.
Hey there. So I think Neil kind of asked about this, but how will you measure the success or lack thereof or whatever of the Smart Restart program? Like a week or 2 from now, you're like, is this endangering public health? Is it working? Is it not working? What sort of statistics will you guys look at?
Well, I think we'd look for a sharp increase. And if the healthcare system tells me we're concerned about the future, then we would have to step back and limit exposure. But I do think following the guidelines, we can safely move forward because we're balancing the health of the economy with the health of people. So we'll just have to be constantly vigilant and monitor the ongoing situation.
Thank you, Mayor. Mr. Matt Henson.
Yes, this is probably best for Dr. Deere. With the Smart Restart launching today, when will we get a clear and accurate picture if people are following the social distancing or if it was a bad idea? when would we see those cases begin to ramp up? And at that point, could it be too late?
Yeah, Matt, that's a really tough question. I do feel that in a week to 2 weeks, we're going to have a good idea whether or not our cases are increasing. Right now, we saw the peak with LM, and subsequently have seen decreased cases, at least on the county level, over that time, despite mass testing. So people had listened and are doing what we had asked them to do. So I think it's going to be a week or two out from our opening today.
And that's why testing and contact tracing is so important to help us isolate the problem before it spreads throughout the community. Because one infected person can infect 400. So we need to act quickly with our contact tracing and our testing to follow this.
Thank you, gentlemen. Next question, Mr. Chris Larson.
Question for Lisa Swanson. Lisa, across your network of stores in the metro area, how are your customers taking all of the changes you guys are making? Are they accepting it as they go? What's been the reaction so far?
Reaction actually has been very, very good. People are appreciative that we are taking steps to protect them and our associates that are working. So we've had a lot of people give us feedback on how much they do appreciate the steps we're taking. And we've been noticing a lot more of our shoppers coming in wearing masks, which we appreciate. And we understand that they are all seeing our encouragements to do that and following, what we are hoping that they will do. So it's been very positive.
As a
Thank you.
customer, I can confirm that because I feel much safer when everyone's wearing a mask and there's proper distancing. Traffic is going one way, there's no crowding. So I concur with her remarks. Absolutely, you feel much better when people are protecting themselves and you.
Thank you. Mr. Ryan Cunningham from KNOX.
Not a question for Lisa, but just a quick comment. I really enjoy personally sanitizing my cart when I'm there, that little spray thing like we have at the gym. I enjoy that actually. That actually made me feel good the last time I was there. For Dr. Deer and for Mayor Brown, getting back to the questions that my colleagues have asked about what you'll see as far as relaxing the social distancing guidelines and when that equates to, was it okay, was it not okay, looking out into the future. Yesterday, Governor Walz in his press conference said what he'll be watching is actual hospital beds and ICU stays, not the number of positive tests. He expects the number of positives to go up with more testing and with more people gathering. He said the metrics are hospital beds and ICU stays. Are those the metrics that you'll be looking for?
Well, we have not relaxed the physical distancing standards. That remains the same. The CDC guidelines remain in effect. So I don't.
To clarify the business openings. To clarify that, the business openings, the allowing for bars and restaurants to be open, that type of thing.
Right, have not relaxed the CDC guidelines. And then Mr. Deer, or Dr. Deer will help us monitor hospital beds and ICU visits to help us stay ahead of this.
Yeah, I agree. That's our most.
Pardon?
Yeah, that's our most vital resource, though, is those ICU beds and our ventilator capacity and the capacity of all of us to care for those patients. So that is a key indicator. So I'd agree with Governor Walz on that.
Thank you, Dr. Deer. We have Mr. Dave Kolpak from the Associated Press. Go ahead, Dave. Oh, sorry. Go ahead.
Thank you. This is for Mayor Brown. Feel free to tell me if this is none of my business, but do you have any plans to go out to eat this weekend?
We're going to continue takeout and delivery.
All right. Thank you.
All right, Dave, Mr. Joe Bowen.
Hey, so this is a community question we got here. The Smart Restart guidelines say for bars and restaurants that they have to keep their blackjack tables closed and that gaming machines have to be 6 feet apart or turned off. And this person is curious about other bar games like pull tabs or bingo. Those can those start back up or no?
We'd have to check with the guidelines to see.
The guidelines don't seem to address it though. That's why they asked me.
Well, then I would think to be cautious, you'd keep them closed until you get guidance on opening them up.
Thank you, Joe. Thank you, Mayor. I have a follow-up question that came online from Mr. Pat Sweeney at KNOX. This is for Lisa Swanson. Lisa, you touched a little bit on the increased numbers on your online orders and delivery type transactions at the grocery store. Do you happen to have those numbers or a ballpark of how much it increased?
We've done some comparisons, and at one time where we maybe had about 100 orders a day, we're seeing 400 orders in a day for one of our locations. So it varies by day, but it is multiplied several times.
Thank you. Mr. Matt Henson from WDAY.
Just to follow up, Mayor Brown, to the fair question. I mean, is that a choice that you have the authority to make, whether or not the fair happens? Or I'm assuming as mayor, at least you have some big say in whether or not it happens?
I think that would be done in conjunction with the county, but if it's a health-related issue, we would talk to Director of Public Health, Debbie Swanson, for input on that. But we're still going to avoid crowds, and we're still going to avoid close physical mingling. So I think right now that would be on hold.
Thank you, Mayor. Mr. Joe Bowen.
Hey, so this is another community question that I asked the governor about, but I assume there's probably some sort of a city angle here too. Basically, as businesses start to reopen at least a little bit, is there a plan for people's children or for daycares? Because if I have to go back to work, or at least can go back to work, but my kids still can't go to school because schools are closed, at least for the moment, is there a plan at the city level to address that?
No.
And as I look at the media here, we got time for one more. All right, Joe, we'll give it to you.
Yeah, sure. Is there a state level plan to address that as far as you know then? Because it
No.
seems like your options are either have the school system kind of handle a big old logistical ball of wax and have schools reopen, or have them stay closed and then you exacerbate the childcare shortage.
My hope is that schools remain closed to protect our most vulnerable in our population. So I do not see schools reopening. And that is what I think is in the best interest of the community, continue distance learning.
Okay. Thank you, everybody. Thank you, members of the media, for joining us this afternoon here at our virtual news conference. And as we have ended this in every other one, we'll have our final word from Mayor Brown. Mayor.
Well, I want to say thank you today to all our panelists. It's great to live in a community that cares, and it's great to see that everyone is making the health and safety of our residents the highest priority. As we begin this GF Smart Restart, remember to be responsible and follow the guidelines and standards put forward by the state. Thank you to our local businesses for the serious and thoughtful approach you are taking, and I encourage the residents of Grand Forks to support local businesses in a way that is safe and responsible. Remember to stay vigilant, stay cautious, slow the spread, and save lives. We're in this together, we'll get through this together, and together we'll emerge stronger. Thank you.
Thank you, everyone. Have a good afternoon.